Joint is basically a junction of two bones. Like this is knee joint. There is one bone there, that is femur. The other bone is tibia. When they join, it's a knee joint. The bone ends are covered by a smooth structure called cartilage. When we walk on the cartilage. And cartilage is a painless structure. But with aging, with use of knee, that cartilage is eroded and the bone is exposed. Bone is a sensitive structure. So when the cartilage is eroded, bones touch against each other, they rub against each other, it causes pain and swelling. That is arthritis. There is erosion of the cartilage, bone is exposed. Now how to protect that painful bone? What we do is, we cover the painful bone with a metal. This is practically a resurfacing of the bone. We are basically mimicking the nature by replacing the cartilage with a metal case. And similarly, the space between the bones that is reduced in arthritis, that is replaced with a plastic structure that is called insert. So this is knee replacement. This is tibia, we are covering the upper part of tibia. This is femur, we are covering the lower end of femur. And this is knee replacement. Anyone who's having pain in the knees, pain which is hampering with the daily activities, pain which requires daily painkillers, pain which requires the patient to modify his lifestyle, should go for knee replacement. Ideally, when the patient reaches the stage of knee replacement surgery, practically there are no alternatives. But yes, sometimes due to some financial constraints, some family conditions, patient is not able to get operated immediately. So just to buy time, we can make use of physiotherapy, knee braces, some intra-articular injections, which are lubricant injections. So they can be used for some time, but they are not a long-term solution and the results are unpredictable. In a primary case, that is the first time surgery, it takes about 20 to 25 minutes. In a revision case, that means someone who already had a knee replacement, which got infected or which is worn out or which is not in the right place or which is not functioning properly, then we have to revise, we have to redo the surgery. In that case, surgery takes longer. It can take up to 1 hour to 1.5 hours. The protocol that my physiotherapy team is following is that on day 1, we allow the patient to sit and stand. On second day, we make the patient walk few steps with a walker. And within a week, most of our patients don't use walker. They can independently walk either with a stick or maybe some help. In 2 weeks, when the stitches are out, the patient can do almost everything. They can climb stairs, they can go to the washroom by themselves, and after 3 weeks, 90% of patients are able to drive also. The reason is that the technique that we are using in knee replacement is not conventional, it's different. We are not cutting the quadriceps muscle, which is the major muscle controlling the function of knee joint. We are using subvastus minimal invasive surgery technique, that is MIS surgery, in which we slide the muscle on one side, we operate and the muscle comes back in its place. There are no stitches in the muscle. That means even during surgery, there is no bleeding. Most of our patients don't need a transfusion if we are operating on one side. Unless the patient's hemoglobin was already below 10, maybe 9 gram or 8 gram, then only we need blood transfusion. Another advantage of subvastus technique is that there is no pain in the post-operative period because the muscle was never cut. It is as good as before surgery, and similarly the scar on the knee is not more than 4 inches. In a conventional surgery, the scar is 8 to 10 inches. So it's not only cosmetically correct, but also physiologically our patients are performing better than patients who have undergone conventional surgery. Apart from running, jumping and contact sports, our patients are able to live a normal life. They can go for brisk walking, they can play tennis, they can go for golf, they can climb stairs, they can board a train. All the activities that a normal person of 50 years or 60 years is supposed to do, they can do it without any effort. The cost is a big factor because many of our patients are not covered by insurance or by government panels. So now we have come with very low rates of the surgeries with imported good quality implants. We are charging 1,80,000 for a unilateral, that is one side knee replacement. For international patients, we are charging $5,000 for one side of knee replacement. It includes 4 to 5 days of stay in the hospital, meals for the patient as well as attendant, physiotherapy, and all the nursing care that is involved during the stay. Our international patients have to stay 4 to 5 days in hospital after the surgery, and about 2 weeks beyond the hospital, means outside the hospital, so that my physiotherapy team can go there, they can do the daily assessments, they can teach them how to walk, how to stand, how to sit on a chair, how to use the commode, how to go to the washroom, and what are the precautions, do's and don'ts that are to be followed after the surgery. With the type of technique that we are using, as I already explained, the sub-osseous minimal invasive surgery, my patients are able to fly back to their country within 2 weeks without the need of crutches or wheelchair.